Hello everyone. Today we are learning another triangle from the anterior region of the neck that is called as carotid triangle. So in this video we will have an outline of the carotid triangle. That means what are the boundaries of the carotid triangle. Then we will learn briefly the contents of this carotid triangle. So on this cadaveric specimen, the carotid triangle boundaries, if you trace, posteriorly we have anterior border of sternocleidomastoid. So this muscle is the sternocleidomastoid passing obliquely. So its anterior border forms the posterior boundary for the carotid triangle. And again, antero-inferiorly we have another muscle here. This is superior belly of omohyoid. So as we have learned earlier, omohyoid got a superior belly here, and again we have inferior belly below. So this is the antero-inferior boundary. Again we have antero-superior boundary. Antero-superiorly we have another muscle here. This is the posterior belly of digastric. This tendon or this belly of digastric will be accompanying one more muscle that is called as stylohyoid. So posterior belly of digastric and stylohyoid together we can see above. So this is the antero-superior boundary. So I am showing you the outline of the carotid triangle. Carotid triangle is located like this. Posteriorly anterior border of sternocleidomastoid, antero-inferiorly superior belly of omohyoid, and antero-superiorly posterior belly of digastric and stylohyoid. Again, if we explain the roof of this carotid triangle, the roof will be covered by the investing layer of deep cervical fascia. But remember, superficial to that, we have to expect another muscle, that is platysma. So platysma will be covering the roof. Additionally, we can expect certain superficial structures like the cervical branch of facial nerve, isn't it? The last terminal, the fifth branch, that is cervical branch of facial nerve, that is supplying to the platysma, that will be located in the roof region of this carotid triangle. Additionally, we have learned certain cutaneous nerves of the neck which are coming from the cervical plexus, especially the transverse cutaneous nerve, transverse cervical nerve of the region that will be located in the roof portion of this carotid triangle. So these are the points to be remembered about the roof of the carotid triangle. When we come to the floor, I cannot show you exactly the floor here because floor is a deeper aspect. In the deeper aspect, we have to expect three structures. In the uppermost part, we have the middle constrictor. Again, beneath we have the inferior constrictor. And again, we have to expect another membrane, that is thyrohyoid membrane. The thyrohyoid membrane is stretching between this thyroid cartilage and the hyoid bone. So this region is the area of thyrohyoid membrane. So these are the points to be remembered about the floor. So next, let us analyze what are the contents of this particular triangle, that is carotid triangle. So the triangle is called as carotid because we can expect the carotid sheath and its contents. Remember, carotid sheath is the modification of the deep fascia at this region which will form an envelope or a sheath for covering certain structures like internal jugular vein and also the common carotid artery, and in between that you can see the cranial nerve, 10th cranial nerve, that's the vagus nerve. These three structures are covered by the deep fascial sheath, that is the carotid sheath. So that will be the main content. Again, additionally, the branches and bifurcation of this common carotid artery, you can appreciate the common carotid artery at the level of thyroid cartilage, upper border of thyroid cartilage, that will bifurcate into external and internal carotid artery. That I will explain you shortly. So the rest of the contents are the carotid body and carotid sinus. And again, we have certain nerves like sympathetic chain will be there behind the carotid sheath. So here this is the sympathetic chain that will be behind the carotid sheath. Additionally, you can expect the spinal accessory nerve which will be supplying to this sternocleidomastoid and further to the trapezius behind. So we have to expect certain other nerves like hypoglossal nerve also, which will cross the external and internal carotid artery, that I will show you in another specimen shortly. The lymph nodes located in this region you can categorize into two, jugulo-digastric and jugulo-omohyoid, that we will explain. So visibly these structures you have to trace in this particular triangle like internal jugular vein, common carotid artery, and in between that vagus nerve, and behind the carotid sheath here we could locate the cervical sympathetic chain. Additionally, the spinal accessory nerve is very well seen. So the rest of the structures I will show you in another specimen. So here in this specimen, it is very clear that our external common carotid artery, that is the left side common carotid artery, that is arising from the arch of aorta. Remember, only left side common carotid artery is a direct branch from arch of aorta. But right side common carotid artery, that is not arising directly from the arch of aorta. Instead, there is a trunk called as brachiocephalic trunk. So the brachiocephalic trunk, this will divide into right subclavian artery and right common carotid artery. So if we specify, right common carotid artery is a branch of brachiocephalic trunk or brachiocephalic artery. This is not a direct branch from arch of aorta. But left side common carotid artery is a direct branch from arch of aorta. This is the second branch. Additionally, from the arch of aorta, we have a third branch called as left subclavian artery that will go to left upper limb. So in this specimen, I would like to demonstrate you the left common carotid artery, its origin from the arch of aorta. After arising from the arch of aorta, it is running upwards. And remember, it will enter to our carotid triangle, and that will be within the carotid sheath. Within the carotid sheath, the accompanying structures are the internal jugular vein and the vagus nerve. These three structures are covered by the carotid sheath here in this carotid triangle. Let us analyze where exactly the common carotid artery is terminating. If you consider both right side and left side, both common carotid arteries are terminating almost at the level of the upper border of thyroid cartilage. So this is the thyroid cartilage. Exactly, if you specify its upper border, at the level of upper border, this common carotid artery will divide into two, that is external carotid artery and internal carotid artery. So this will be corresponding almost at the level of disc between C3 and C4. So this is the vertebral level. So this is the termination of your common carotid artery. And remember, in the carotid triangle, quickly you can identify which one is external carotid artery and which one is internal carotid artery. Remember, only external carotid artery will provide certain branches here in the carotid triangle. So this is a branch. So this branch is arising from external carotid artery. So the artery which is giving branches, that is the external carotid artery. The artery which is going upwards without giving any branch, that is the internal carotid artery. This internal carotid artery further will reach at the base of the skull and enters through the carotid canal. Further, it will enter to the cranial cavity to supply the meninges, brain and associated structures. That is the internal carotid artery. But external carotid artery will provide several branches here. Totally there are 8 branches for the external carotid artery, but remember, all the branches are not located in the carotid triangle. Shortly we will list out what are the possible branches here in the carotid triangle. So initially the external carotid artery will be anterolateral to the internal carotid artery, but later towards the end that will become anteromedial to the internal carotid artery. So that relationship also you can remember. So I would like to explain you certain branches which are visible in this specimen. So the first branch of external carotid artery, this is called as superior thyroid artery. So this is the first branch, and that will be mostly arising from the anterior aspect or the ventral aspect of external carotid artery. As the name suggests you, superior thyroid artery will come to the thyroid gland, towards the thyroid gland. Once it is reaching to the thyroid gland, that is apex of the thyroid lobe, that will usually divide into an anterior branch and posterior branch. The anterior branch will run along the anterior border of thyroid lobe. Further, it will reach to the isthmus and it will run along the superior border of the isthmus, and it will anastomose with the fellow artery of opposite side. That means the anterior branch of right external carotid artery, that is right superior thyroid artery. So this will anastomose at the superior border of isthmus. But remember, its posterior branch or posterior division, that also will run downwards along the posterior border, and that will be anastomosing with the ascending branch of inferior thyroid artery. So that anastomosis happens along the posterior border of thyroid lobe. So when you are explaining the superior thyroid artery, you should never forget one of its important branch, that is the superior laryngeal artery. So remember, from the external carotid artery, this is your superior thyroid artery coming towards the apex of the thyroid lobe. From the superior thyroid artery, you have an important branch called the superior laryngeal artery. As the name suggests you, that is going to the larynx. Remember, this artery will come forwards and it will pierce a membrane called as thyrohyoid membrane. In between thyroid cartilage, upper border of thyroid cartilage and hyoid bone, you have thyrohyoid membrane. So this artery will pierce the thyrohyoid membrane in order to enter to the interior of the larynx, and it will supply the laryngeal cavity above the level of vocal cord. So this is called as superior laryngeal artery. This is a branch of your superior thyroid artery. Superior thyroid artery is a branch from external carotid artery. Next branch from the external carotid artery is the lingual artery. Remember, lingual artery will arise very close to the greater horn of hyoid bone. So this is the second branch. Again, this is a ventral branch. So this is the lingual artery. This is having a tortuous course. So this will supply to the tongue region. The third branch of the external carotid artery is the facial artery. But here in this specimen, the lingual artery and facial artery is arising from a common twig. This is a variation. But usually facial artery will arise from the external carotid artery as a separate one just above the greater horn of the hyoid bone. That means just above the origin of the lingual artery. So this is lingual artery, this is facial artery. Facial artery also is having a tortuous course that is related to the submandibular salivary gland, and that will enter to the face at the level of anterior-inferior angle of masseter muscle at the base of the mandible. So remember, this is the parotid region and parotid gland. The parotid gland we were dissecting and reflecting so that the course of this external carotid artery within the parotid gland is clearly visible. And this external carotid artery will pierce a membrane called as stylomandibular ligament, not a membrane, stylomandibular ligament, and that will enter to this parotid region. Remember, its termination is very important. The external carotid artery will terminate almost at the level of the neck of the mandible into two terminal branches. That is the maxillary artery that will enter to the infratemporal fossa, and further it will run upwards as the superficial temporal artery that will supply the temporal region. So superficial temporal artery and the maxillary artery, these are the terminal branches of external carotid artery. So this is the picture to demonstrate you the origin of the common carotid artery, further the course of common carotid artery and its bifurcation in the carotid triangle region or in the neck region. And to have an idea, this is the arch of aorta and its branches. So here we have thyroid gland. This is the thyroid cartilage with the laryngeal prominence, and this is the hyoid bone. And in between the upper border of the thyroid cartilage and the hyoid bone, we have a membrane. This is thyrohyoid membrane. And remember, the common carotid artery, this is left side, that is arising directly from the arch of aorta, and that will run upwards. And once it is reaching at the level of upper border of the thyroid cartilage, this is bifurcating or dividing into external carotid artery and internal carotid artery. Look at the picture and understand, internal carotid artery is not at all giving any branch here, but external carotid artery will provide several branches. So the first branch is superior thyroid artery. This superior thyroid artery, after arising from the ventral aspect or the anterior aspect of the external carotid artery, that will run downwards. And once it is reaching to the apex of the thyroid lobe, that is dividing into anterior branch and posterior branch. This anterior branch will run along the anterior border of thyroid gland, and it will anastomose with the fellow of opposite side artery at the upper border of isthmus of thyroid gland. But the posterior branch will run along the posterior border, and it is anastomosing with the ascending branch of inferior thyroid artery. Inferior thyroid artery is a branch of thyrocervical trunk that we will learn later. Before reaching to the apex of the thyroid gland, this superior thyroid artery will provide a branch. This is very important. This is called as superior laryngeal artery that will pierce the thyrohyoid membrane in order to enter to the interior of the larynx or laryngeal cavity. Another branch again from the ventral aspect is the lingual artery that is arising very close to the greater horn of the hyoid bone. This is hyoid bone. Very close to the greater horn of the hyoid bone. Another ventral branch, lingual artery, that will go to the tongue. Just above the greater horn, another ventral branch we got, that is the facial artery. So this is the facial artery that will run, that got the cervical part and the facial part that we will detail later. Again, we have opposite to facial artery, from posterior aspect we have a branch which is running upwards and backwards. This is called as occipital artery. Above that you have posterior auricular artery. So again, from the medial side of this external carotid artery, we have a branch which is running upwards. This artery is called as ascending pharyngeal artery. This artery you can trace by tracing in between external carotid artery and internal carotid artery, because this will be located between external carotid artery and internal carotid artery. This artery is called as ascending pharyngeal artery. Let us see the terminal branch. In fact, these terminal branches are not located in the carotid triangle region, but still we have to know. At the level of neck of mandible, the external carotid artery will divide into maxillary artery and superficial temporal artery. These two are the terminal branches. That's all about the external carotid artery and its possible branches. So next content is the internal jugular vein and its possible tributaries. Remember the position of the internal jugular vein in the carotid triangle. That's very easy. To have an outline, this is the superior belly of omohyoid and this is the sternocleidomastoid. These two muscles I am reflecting now. And here we got, along with the common carotid artery, we got a very thin vein. So this is one of the largest vein in the neck. This is largest vein in the neck. This is called as internal jugular vein. So this internal jugular vein and the common carotid artery will be together. Additionally, along with this, you could see the vagus nerve. This is the vagus nerve running downwards. So these three are covered by the carotid sheath. And remember, the internal jugular vein, its tributaries we have to know, like facial vein and also the lingual vein. These tributaries are joining to the internal jugular vein at this triangular region. So one more important content in this carotid triangle I would like to mention, that is your hypoglossal nerve, more towards the upper part of this triangle. So this hypoglossal nerve, easily you can identify, that will run downwards forwards by crossing the external carotid artery and internal carotid artery superficially. So superficial to external carotid artery and internal carotid artery here, this is the hypoglossal nerve. This is the motor supply to the tongue muscles. One more structure which is more towards, especially behind the carotid sheath, that you have to know. So this is the cervical sympathetic chain that will be located behind the carotid sheath. This also is an important structure in the carotid triangle.
Next structure to be explained in the carotid triangle is carotid sinus and carotid body. So the carotid sinus is just a dilatation at the termination of the common carotid artery or even at the beginning of the internal carotid artery. And this dilated portion consists of certain receptors and which can detect the pressure of the blood which is passing through this. That means these are the baroreceptors. And the carotid body, that is just a discoloration, reddish brown discoloration at the termination of the common carotid artery. And this carotid body contains the chemoreceptors which can monitor the chemical composition of the blood which is passing through this. Next content to be explained in the carotid triangle is the lymph nodes, that is the deep cervical group of lymph nodes, the jugulo-digastric nodes and jugulo-omohyoid nodes. The jugulo-digastric nodes are seen along the posterior belly of the digastric muscle, that is below the posterior belly of digastric muscle, and the jugulo-omohyoid nodes are located above